Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual. And today I'd like to have a conversation with Dr. Todd Zimmerman, who works in Las Vegas, about what it means to be a medical director and what can we, those of us who want to go into administrative work, can do in order to look into that kind of a career. Dr. Todd Zimmerman has been a medical director for many years. This is in addition to his clinical work, so I thought it would be a perfect person to discuss such a topic. So, welcome, Todd, for the show. Appreciate your time. I know you're a busy guy, and I appreciate you taking the time to give your advice and your opinion to the PEM Rules listeners. Let me just introduce you to the listeners. Todd is originally from Merrick, Long Island. He completed his medical school at Chicago College of Osteopathic Medicine in Midwestern University and his general pediatric residency at Lutheran General Hospital, graduating in 1998. Followed that, Todd did his PEM fellowship at Cook County Hospital in Chicago, graduating in 2001. In 2003, Todd co-founded a medical malpractice insurance company, and he has since also served as the PEM director for two different pediatric emergency departments. He is currently the medical director at the pediatric emergency department in Las Vegas. He's also, and you've been in that role since when, Todd?
Since 2018.
2018. He's also been a PEM consultant for the Sullivan Group, a risk management company that provides thorough CME for EM clinicians and other subspecialties since 2005. In addition, as a medical director of informatics in Chicago, Todd has worked to redefine the templates for inpatient, outpatient units for one of the largest health systems in the country. Did I miss anything, Todd?
No, that's it.
That's about it. Okay. Welcome, Todd. How are you?
I'm doing good. Thanks for having me. Appreciate it.
You're very welcome. And again, thanks for your time. My first question to you, Todd, and again, if you've listened to PEM Rule, you know it's a question I ask all the guests. What is your definition of a good PEM physician? One who does what?
I think Ted Lasso said best as be curious, not judgmental. And that goes so far along so many different lines of what we do, whether it's working with a resident or listening to a parent or talking to a nurse or discussing with a consulting physician or admitting physician. There's always going to be times where people see eye to eye, and there's always times where people are going to see things differently. And that's understandable because at times we're looking at things through a different lens. And I can say that earlier in my career, I used to get incredibly frustrated. And over the years, as I've grown, still growing, of course, but as I've grown, I've really learned to practice what I never really put into words, like Ted Lasso did in that great show, is to just be curious, not judgmental. People have different views, and ask them different questions, ask them their thoughts, and when you approach things that way, it doesn't always work, but it usually helps, makes things a lot easier.
Very nice. So, with your permission, I'm going to add it as one of my rules, if you don't mind, and I'll give you the credit. Obviously, I think that's a very, very good rule. Easier said than done. Sometimes I get that. But yeah, no, I totally agree. Thank you very much. My next question to you, Todd, and this is, I guess, specifically to someone like you. You have been a director for many years, and you're in the business of hiring PEM physicians and PEM providers, PAs and NP. Can you tell my listeners, many of which are in the business or looking for a job at some point, what are the things a PEM graduating fellow, or again, a PA, can do to increase his or her chances of getting the right job? What do you look for in the people that you hire?
What I'm always trying to do is to find people as good or better than me. That's how you become successful, and that's how you build a team where everybody wins. What I look for in people for candidates that I'm considering hiring is it doesn't matter the environment that you're working in, because every environment has its own stresses. It's equal stress, but different stress. You can be working in an academic institution. You can be working in a pseudo-academic institution. You can be in an institution where there's absolutely no teaching at all and you're single coverage. You're always going to have your own stresses, and those stresses are really, really, really difficult. So what I talk to candidates about is, it's super important to offer solutions, because there's always going to be problems, right? And you always build on those opportunities. And so I specifically look for people and talk to the candidates about this. When problems are going to arise, and when they arise, offer solutions, not complaints. And really, that pays incredible dividends when you do hire people like that, because it just helps out so much. Because it doesn't matter if I'm doing this as a medical director for 22 years. You could be a right out of fellowship. You can be a seasoned doc. You can be a mid-season doc, and anyone can learn from anybody. Like I said, something about viewing things from a different lens. Everyone's lens is a little different. And when you really listen to people and not just give them lip service, like, oh yeah, thanks for that, but really listen to them and bring the team to the table, you get that buy-in and you get that sense of ownership. To wrap that is, I know I went off on a little tangent, a little story there, but to wrap that up in a nice bow, it's really looking for people that are basically change agents. And that's what I love. I love hiring people that are change agents. See, it's not a problem, it's an opportunity. And it's not a complaint, it's a solution. And that's those are words that I live by.
Very nice. I couldn't agree more. In fact, one of my rules that I love to tell the residents is complaining is like vomiting. It makes you feel a little better. It makes everybody around you feel a lot worse. Leaders don't complain. So I agree with you. Again, easier said than done, but I couldn't agree more. Next question, Todd. And again, that's specifically for someone who's in your position. A lot of us PEM providers, PEM physicians, at some point in our career look for other avenues within PEM to kind of occupy our time. For me, I know that it's teaching and academia, and you've been an administrator for many years or a director. What advice? I'll say before that, I'll say that being a PEM director, it's kind of a tough job. With you dealing with scheduling, hiring, budget, complaints from the consultant, and it seems to be just a very time-consuming kind of position. What advice would you give people in a year or two or three after fellowship who are seeking that avenue within PEM?
People that are looking to move into that directorship position.
Correct.
You're talking. Yeah. So I have a great story about that. So my last institution that I was at, I worked my way up to being the medical director for two pediatric ERs within a health system. And I was administrative director for both hospitals and the health system while being the medical director of informatics. And I was involved with med exec, and I was involved with new business development, and I would be in all of these meetings with these seasoned administrators, and we would discuss, what the vision is and what hurdles do we have and how are we going to get there. And in these meetings, I would offer suggestions, and and not uncommonly, they were basically pushed to the side, even though I knew that was the right avenue to take. And then at a meeting like a couple of weeks later, one of the head administrators would basically bring up that idea. I think we've all lived through that. I got very lucky because I was getting more and more frustrated being in these meetings that were becoming more and more of what my secondary job was, and took up a lot of my time. But I loved it. I loved the building. I loved the growth. And I was in a meeting, and I brought something up like a couple weeks before, and the administrator then was like, "Yeah, let's do this." And everyone's like, "Oh my God, that's exactly what we need to do." And like I said, I was very frustrated. And there was a relatively new CMO at that time, but he was a very seasoned CMO. He was just new to the health system. He called me to his office, and he said to me, he said, "Listen," he goes, "you know what you're doing." He goes, "But the one lesson that you haven't learned when working with hospital administrators is that as a physician that understands business," he goes, "you can't tell them what to do." He goes, "you need to guide them into making the right decision." And I was missing that tool. And I wish I had that tool earlier in my career, because I probably would have been, successful earlier on. Um, I built up the success that I have, and I continue to try to build on it. But if I had that tool of, when you're in meetings with people, and as you're growing, and people are there in those meetings that are seasoned and tenured, and have a higher position within the health system that you do, they don't want to hear from people for the most part on what to do. But like I said, you guide them into that, and into what the right decision is to make and what the right vision is. So it was the most valuable tool and valuable lesson that I ever learned.
Very nice. So what I'm hearing you saying is guide the people you're working with. Don't tell them what to do.
Exactly. Yeah.
Guide. So kind of make them think that they're reaching their own conclusion. You're just kind of pointing them at the right direction.
Correct.
Very nice.
Yeah.
All right. And on a different aspect, talking about your clinical work, because again, in addition to everything you're doing, you obviously have been seeing patients for many years. What advice would you give to someone, let's say a graduating pediatric resident who's considering going into PEM and making that a clinical career for 20 or 30 years?
The most valuable piece of advice that I would give someone going into pediatric emergency medicine is look, watch, and listen to your patient. And always remember that there's nothing as powerful as your complete physical exam. That's the best data that you're going to get, right? The best data that you're going to get is what the parent or the caretaker or the child tells you, and how the child looks, and your complete physical exam. I when I work with residents and fellows, and parts of the physical exam are missed. It just it irks me. And I'm not suggesting if you stub your toe, you gotta do orthostats, and you have to do you have to do all your DTRs. So that would be nice. But it's just if you have a medical patient, sick patient, do your complete physical exam. You just throughout my career, I've been very lucky. I've worked with extremely talented physicians like yourself, and I've been in situations where I remember throughout my career where patients were signed out to me, and there was sort of a difficult case, and you go into the room, you do your complete physical exam, and now you got it. Um, the power of the physical exam, can never be forgotten. And what I said in the beginning is extremely important. Is as you're talking to the caretaker or parent and getting that history, keep an eye on the kid, and see what they're doing, and see how they look, and how they're acting, how they're breathing. How's their, are they vigorous? Are they interactive? That's some of the most because that's always a powerful tell from the child. When as you're talking to the parent, because they know that the doctor's focus is not on them for a moment, and they don't have to be as scared. So really, look, listen, feel. and then again, your complete physical exam is the most powerful tools you can ever have, and never should be forgotten.
Very interesting. It's interesting. It's almost always, when I speak to other physicians, we have so many tests and images available to us, but for the most part, it almost always goes back to the basics. Isn't that interesting?
Absolutely.
Yeah.
Yep.
Well, Todd, thank you very, very much for coming on the show. Your advice and your experience is greatly appreciated. Lastly, as you probably know, we have a tradition in PEM Rules where I try to play the outro of the choice by the guest who came to the show. And I know for a fact that you like Greta Van Fleet. So, how about Highway Tune by Greta Van Fleet for the outro?
Sounds great.
Perfect. Thanks again for your help, Todd, and thanks for coming on the show.
Hey, thank you.
And that is it for today, guys. Thank you very much for listening to PEM Rules. I hope you learned from Todd and his experience and wisdom. I hope you continue to listen to PEM Rules. Check out the website, check out the Facebook page, submit any feedback. I love hearing from you guys. And if there's anything you want to hear on the show, please let me know. This is one of my favorite songs by Greta Van Fleet. It's called Highway Tune. Hope you like it. Thanks very much.